All right, let's go ahead and get started. Good morning, everyone. I'm Christine McNeil with KY Innovation with the Cabinet for Economic Development. Welcome. This is our third seminar series in our series with Eva Garland Consulting on for SBIR, STTR companies and people who are interested or are already pursuing that avenue. So Vicki Catani is with us today. She's going to be presenting this next webinar with our research strategy. So thank you, Vicki, for joining us.
Hi, Christine. Thank you so much. As she said, I'm Vicki Catani. I'm a scientific consultant at Eva Garland Consulting. A little brief introduction about myself. So I did my PhD at the University of Rochester in upstate New York in evolutionary genetics. Then I moved to New York City, where I did my postdoc at the Center of Genomics and Systems Biology. Then I continued my southward migration, and I live now in North Carolina. I did a short postdoc here at NC State University. And soon thereafter, I started working here at Eva Garland Consulting, where I have been helping a variety of companies to move their technologies forward. I've been helping companies write their grants for agencies such as NIH, NSF, the Department of Defense, and other minor agencies such as the USDA, the Department of Education, and other private foundations. So I'm happy to be here with you to talk about developing your SBIR, STTR research strategy for the third seminar of the Kentucky Innovation Investment Program. So a brief overview of our agenda. We're going to talk about what makes a good research strategy, how much preliminary data do you need, what are the reviewers looking for in your research strategy, and how you can partner with an academic collaborator. Then this might be important for a lot of you. One thing that I want to add, if you have questions during my presentation, you can type them in your chat boxes. So if I see them, I'm going to try to answer the questions as we go along. Christine also is going to be looking at the chat box, and if she sees something that I don't see, she's going to try to bring them up. And also at the end, I'm going to try to answer some questions that have been left unanswered. So let's start with what makes a good research strategy. So the first thing that you always need to do is to define your project. And by that we mean, what is your value proposition? How is your solution unique? What differentiates your product or your technology from other solutions? And what do you need to do to achieve your next research and development milestone? So it's always important to have a clear and defined development path. You should start by outlining the pathway for how technology would get from the current point of development to a commercial product. You should determine what is feasible within the project period and the budget of the grant. So this is sort of a mock development path that I always like to show. So for instance, you may have right now to do some prototype optimization, followed by some in vivo testing. Then once you have a prototype that has been tested in animals, you might need to do a first-in-man clinical trial. And then after that, you might have to do an efficacy phase 1 to clinical trial. I also put some sort of estimated numbers of how much of those instances are going to be costing you. So let's say the prototype optimization is going to cost you around $100,000. The animal testing is going to cost you $150,000. The clinical trials, $3 million, $50 million. And also you need to be able to estimate how long each of those steps are going to take you. 6 months, a year, 2 years, whatever. And at the end of that pathway, you should be able to say, okay, my product will be ready to go to the market. So within that sort of development pathway, what will the SBIR or STTR be able to get you? So in this case, for let's say a phase 1 SBIR, STTR, sort of the sweet spot will be, the prototype optimization and maybe the animal testing, because that will be able to cover around $250,000 and one year. So another important thing for you along this pathway is you should be able to identify key metrics that will be used to evaluate if the project is successful. So at the end of these steps along the way, so at the end of the prototype optimization step, at the end of the in vivo testing, you should be able to identify these key quantitative metrics that you will use to evaluate if those steps are successful. So the next thing for any kind of project is for you to be able to set up your specific aims or your technical objectives, as some other agencies call them. So specific aims or technical objectives are usually 1 page in length. And that's where you introduce your problem. Usually, it should take you around 1 paragraph. The next paragraph should be where you describe your unique solution to the problem. Then you describe what needs to be done to prove feasibility and the qualifications of your team who will carry out the work. That should be your 3rd paragraph. And then you should list between 1 and 3 specific aims that very concisely state the technical milestones that you will achieve during the grant period. And you should try to include the measurable metrics of success for each of those aims. So examples of these aims, you will like to develop a drone with 99.9 accuracy in landing within a specified zone, test the mechanical stability of a new prosthetic device, and a metric can be, it must meet the regulatory agency criteria. Or correlate the usage of a hospital software system with the reduction in treatment errors, and a metric can be, 40% reduction compared to current practice. And these are just some examples. So after that 1 page specific aims, usually what you have is the main research strategy document. The format of this research strategy document varies among all the agencies. So typically, it's between 6 and 15 pages for a phase 1 proposal. But it must include the discussion of the significance of the problem you're solving, the innovation of your solution, the approach of how you will use to evaluate the feasibility of your technology, and the timeline for completing the project. So what is that significant section? So this is the first section that the research strategy should have. So this is where you explain what the problem that your product is trying to address is. You should describe the unmet need, and that includes the size and the cost of the addressable market. Explain what the current state of the art is, and what are the limitations of what is currently available. And how does your technology or your product fill that unmet need? And that will set you to transition to the innovation section. So the way we usually tackle the significance section is that we have an introductory paragraph where we clearly state the problem. Let's say, brain cancer is bad, it affects however many number of people. This is the prevalence, this is the incidence, this is why it's bad. You talk about the impact of the disease that you're addressing. You talk about the inadequacies in the current systems that you will be solving. This is the current, this is how we treat breast cancer patients. We do, I don't know, chemotherapy or radiation, but these are the limitations of these treatments in patients. And be sure to include supporting sentences that focus most heavily on the health-related aspects of the problem, but also address economic and societal factors. And by that, you can say that the current treatments are incredibly expensive. And be sure to put those numbers if you have access to those numbers from the literature. And also societal factors, maybe the societal impact of that. And conclude this paragraph by re-emphasizing the need for a better solution. And then after that first paragraph, you're gonna have a series of supporting paragraphs where you further describe the unmet need that your technology will address. And there may be specific issues that need further clarification, such as the pathogenesis of the disease that you're addressing, or the limitations of the current products, and this depends a lot on the type of product or technology you are developing. Something to keep in mind is that remember that some of the reviewers may not be experts in your field, and we're going to talk about sort of the composition of the reviewers panel towards the end of the presentation. So you need to educate reviewers on specific technical issues that are limiting the current products on the market and others in development. So let them know why there are limitations with the products that are out there and why your product is gonna fill those gaps. And then you're gonna have a conclusion paragraph that is where you introduce your technology. And you're gonna tell them how will your technology address the unmet need that you just defined in the previous paragraphs. And be as specific as possible about the problem that you're solving and the impact that your solution will have on all aspects of the problem, either if it's defense, education, health, economic, or societal. So that is a significant section. So the second section of the research plan is the innovation section. And that is where you have to define what makes your product innovative. So remember that for these agencies, you need to emphasize that your product is not iterative, but groundbreaking. So an example of iteration will be to say, we will alter the material or the construction of an existing device to make it more efficient or to broaden its application. For instance, you are going to change, the color of the wing of a drone to yellow because you think that, children will like the yellow better because it's more exciting. Well, no one will fund you for that product. It's important to differentiate yourself from the competition. An example of that would be saying, there is no other product in the market capable of delivering minimally invasive ultrasound therapy directly into deep-seated gliomas or brain tumors. The BoomCat, and that is the name of a product, will deliver minimally invasive therapy more efficiently than available products with minimal side effects, reducing the time between visits to 1 month. So remember to be as specific as possible when you are differentiating yourself from the competition. Also talk about what will be the impact of your product. Talk about the size of the unmet need. And I'm gonna give you an example. In 2017, it was estimated that 1.5 million new cases of cancer will be diagnosed, with 500,000 of those patients projected to die from the disease. Talk about the costs, both financial and societal, associated with that need. For instance, a recent study estimates that the yearly cost of malignant tumors in hospitalized patients at $5.4 billion. You can also paint a picture of before and after, and this can be graphically, like I'm going to show you now, or in words. For instance, this is what the telephone technology used to be before we developed modern technology. This is what it is right now. And And this is how we usually set it up. We have an introductory paragraph where we restate the unmet need, and this is how it ties into your significance section. We explain how your technology overcomes the existing limitations, how we are addressing the issue in a unique and innovative way, how will your solution will be superior to other existing or potential solutions to the problem. And then we have a series again of supporting paragraphs where we provide more detail around the innovative aspects of the technology. And we usually like to include a comparison chart with bullet points on the capabilities of the current technologies and the differential advantages of your technology over the others. So this is a really useful way of sort of focusing the reviewer's attention of what's really unique about your product if you use bullet points, because then that draws the reviewer's attention of what's really important. You should also mention any licensing agreements or patents that you may have filed, as well as your plans to file additional patents. And also discuss the freedom to operate. And finally, a conclusion paragraph where you reemphasize the groundbreaking nature of your product and where you explicitly convey the impact that your product will have on addressing the unmet need. So now you're ready to move on to the approach, which is the main section of your research strategy. And again, if you have questions, you are free to type your questions in the Zoom webinar chat. So the first sort of subsection of the approach will be the preliminary data or the supporting data. And this is where you're going to discuss the strengths and the weaknesses of the prior research used to support the application. And then you will explain how you will accomplish your specific aims or your technical objectives. And for each aim, there are different sections that you should be including. And these are the experimental design, how you're going to accomplish what you say you're going to do, the metrics of success, what are you going to be considering a success for that aim, the potential pitfalls and alternative approaches, the rigor and reproducibility, and we're going to explain that a little bit later what that is, a timeline of how long it's going to take you to accomplish that aim, and the next steps. So what is experimental design? So you're going to have to use outside experts probably to vet some aspects of your development plan. Another important thing is consider the budget when designing the scope of work, right? So make sure that if you're saying you're going to do all of these things, they need to be consistent with the overall budget of the proposal. Consider dividing your aim into tasks and subtasks if necessary. If your aim needs to be, you need to accomplish different tasks for each aim. Don't just write like a very long paragraph or a very long narrative. It's easy if you divide it in different tasks. Include a level of detail that is sort of similar to a scientific journal. Make sure to include controls and statistical methods. The metrics of success. So you need to include the major milestones and go, no-go decisions. And importantly, those metrics of success need to be quantitative when possible. And we're gonna give you an example. So the potential pitfalls and alternative approaches. So that's where you should discuss what potential problems could occur when you are doing that experimental design, how you would address those problems, and what alternative experimental strategies you can use. For rigor and reproducibility, you should describe your experimental controls, both positive and negative, how you plan to reduce bias, and that can include blinding and randomization. You should detail your power analysis to determine how many samples you're going to use, and you should describe the statistical methods you're going to use to analyze your data. A timeline is also very useful to include, at the end of your proposal. And that is to give reviewers an idea that you know how long each of your tasks is going to take, and that you are positive that you're going to be able to accomplish all your aims in the timeline of the proposal. For a phase 1, that's going to be a year. For other types of proposals, this can vary. So we usually like to use this type of charts, you know, tables or Gantt charts. You can also talk about next steps and basically describe how the proposed program will inform future activities. Basically, you know, the successful completion of a phase 1 will allow you to do this and that, or in a phase 2 to move on with your development plan as you outline. So references. This is important for you to think about. You can generally use references liberally. There is usually no limit. There are certain circumstances for some agencies where they would limit you, but that is not usually the case. Make sure to include references for all statements of fact, the number of incidents, limitations of current technologies. Include multiple references for each point, particularly if your statement may be considered controversial. Make sure to use references from highly regarded peer-reviewed journals in your field. Non-peer-reviewed citations, such as personal communications, are not recommended. Website references should be avoided, unless you're referencing a well-established source, such as a federal website. And that can include if you're citing some kind of data from the CDC or from census data, but other than that, try to avoid websites. Do not include Wikipedia articles or references. Wikipedia might be useful when you find the links in Wikipedia that will help you find other articles for primary references, but do not use Wikipedia articles. And use the agency recommended formatting for your references, and this varies by agencies. Some agencies have recommended formatting, some agencies don't, so make sure to read the funding opportunity announcement to see if they do have some limitations. So there is a question from Scott. He's asking, in all of the specific aims pages that he has seen, they do not include any references, even though they are citing various sources. Is this common practice for that section? It is true that some specific aims that we have seen do not include references. We actually include references in the specific aims. So I would recommend, Scott, that you do include references in the specific aims. The way we do it is we basically just write the specific aims together with the research strategy, and we put the references all together, and just when we're done writing the aims and the research strategy, we just separate them when we need to upload them separately. But the references are should encompass both the aims. Yes, Scott is asking whether a numbered list is okay. For most agencies, I think it's okay. Again, you should check whether the agency has a restriction on how they would like the references to be done. The way we usually do it is like, yeah, we put numbers, and then in the references, you put the number and the whole reference there. Okay, some do's and don'ts for your research plan. So as we said before, do provide details, but don't provide that many details. And this is a fine balance that you will see. An example of enough detail. You know, primary cells will be prepared by research spending in minimum essential media containing 10% FBS to a concentration of something in each well of a 24-well plate and placed at 37 degrees for 24 hours. And don't will be, you know, just way, way longer. Primary cells will be prepared by adding cells to a hemocytomer and counting to determine the number of cells per milliliter. Cells will be then be transferred to a 15 milliliter tube of minimum essential media. So I'm not, so I'm not gonna read it all, but you get a sense of how, you know, a certain amount of detail is necessary, but not an extreme amount of detail. Do provide metrics, but don't make them vague. So a good metric of success would be, the metric of success is to improve plant yield by 10% compared to controlled treatments. A bad metric of success would be, the metric of success is to improve plant yield. Because if you just say that you're going to improve plant yield, that is very vague. Whereas if you say that you want to improve the yield by 10% compared to control treatments, that is much more specific and quantitative. Okay, so moving on to the second part is, how much preliminary data do you need for a phase 1 SBIR or STTR? So you shouldn't consider preliminary data optional. And this is a little bit tricky because if you, for a lot of agencies, you know, for a phase 1, you know, strictly speaking, they do say that preliminary data, you know, is optional. But the reality, when reviewers are, you know, judging and reviewing your applications, they really do not consider preliminary data optional. So the important thing is that you really need to clearly present preliminary data. Never consider it optional. You can use data that supports the use of a technology for a different application. So even if you don't have preliminary data that is directly related to what you are proposing for your application, you can leverage data that you may have for a different application of your technology to use it for what you're proposing. And when you clearly present your data, you know, you need to provide sufficient information regarding your experiment. And, you know, use a lot of graphs and tables to provide a clear representation of your results. And make sure to include at the end of this section a statement of a study outcome. So to make it clear to reviewers, what exactly did you get from that study? Don't forget to provide sufficient information regarding the experimental approach so reviewers know what exactly you did. Again, use graphs and tables like the one I have on the right. And provide details to support the scientific validity of the project, including controls, the number of replicates, statistical analysis. Your preliminary data should be as rigorous as possible. And again, include the statement of a study outcome and your conclusions. Don't just throw a bunch of graphs together. So what are reviewers looking for? One thing that is important for you to know is, who are these reviewers? Who is the audience? And the picture that I have there in the bottom, believe it or not, is an actual study panel for NIH. So these are a bunch of people sitting in a room. It looks pretty uncomfortable. So our review panel usually consists of a mix of established academic, clinical faculty, as well as individuals who may not be experts in your field. So usually scientific review officials create panels with broad experience. And every panel has a unique personality. So sometimes it is important to find out as much as you can about the panel before you apply. And the way you can do that is that particularly NIH sometimes has a roster of the people that are going to be in the panel beforehand. If you look at the study sections for SBIRs and STTRs, and if they don't have it beforehand, they may have the roster of the people who have served in the panels before. To have, sometimes they return, so you may have an idea who may be coming back. But also for you to have an idea of what kind of people can usually be found in the study sections where your proposal might end up with. So the general makeup of the review panel is a third of academics, a third clinicians, and a third of business people that might be people from small businesses or companies, CEOs or CSOs. And so it's sometimes tricky because you need to appeal to all three audiences. Academics are looking for experimental details. They're looking for robust experimental designs. They're looking for key publications. They're looking for a thorough understanding of the field. Whereas clinicians might be looking for the clear understanding of unmet need, right? So they might be, oh, yeah, I really want to help, these babies that are dying of these premature disease. And also they're looking for reimbursement and value for the price. And then you have these business people that are really focusing on a logical development plan. They want to know what the product is going to look like and who are you going to sell this product to. So they want a realistic understanding of the commercial potential. And also they're looking for a viable business team with a track record of success. And this might be more important for phase 2s. So understanding the review process it's really important. And one thing that you should always be doing is reviewing the solicitation for the review metrics. So make sure you include all the required information as specified by the solicitation. And by that, if you look at the solicitation and you see that your solicitation, for instance, in the case of NIH, is going to be evaluated in terms of its significance and innovation and the team, make sure that in the research plan you put a heading that says innovation. If it's going to be evaluated on significance, you make the heading of significance. If it's going to be evaluated based on the approach, you put the heading approach. So make it easier for reviewers to find that information in your application. As I said, make your application easy to review. Be concise, emphasize and repeat the key points. We usually encounter these problems where sometimes, we get the summary statement where you read the reviews from the panel and people say, well, I don't understand, I mentioned this. I can't understand why the reviewers didn't see when I mentioned what, that I was going to do X, Y, or Z. But maybe you said it only once and it was buried among a very long paragraph. So it's not bad to repeat, the key points that you want reviewers to see. And don't be afraid, to highlight things, put things in bold that are really important. If you're highlighting the unmet need or you're highlighting, the key innovations for your product, you can underline things. You may want to put things in, italics. Use figures. Reviewers are very, very keen on looking at figures. Of course, make these figures easy to understand. Don't put very complicated figures. Make sure that you label these figures properly. But figures and tables usually are the first things that reviewers are going to look like to understand things quickly. Because remember that reviewers do not have a lot of time to look at these applications. So everything that you can do to make things easier for reviewers will actually be in your favor. So one thing that sometimes, companies in which their key personnel come from academia have a hard time grasping are the main differences between, academic grants versus SBIR and STTR grants. So for instance, there are some, the review criteria, the difference between academics and SBIR and STTR grants. For overall impact, for academic grants, usually, they need to be interesting. For SBIRs and STTRs, it needs to be compelling. Reviewers, when they read, that first paragraph of the specific aims or that first paragraph of the significance, they really need to see the unmet need. Why is this a problem and why do we need a solution? Like, why is this so bad and why are the current approaches really limited? For the significance, in the academic grants, it needs to advance the field. For SBIRs and STTRs, it needs to advance usually human health, if we're talking about usually for NIH. For the innovation criteria, for academic grants, it needs to be novel. The main difference for SBIRs and STTRs is that it needs to be feasible. Because remember that the ultimate goal here is that you need to be creating a product or a technology that it needs to be marketable. For the team criteria, for academic grants, reviewers are always looking at the bio sketches and they want to see lots of publications. For SBIRs and STTRs, you want to be able to have people in your team that have commercialization experience. That is the key difference. For the approach section, for academic grants, they want to see a lot of data, a lot of horizontal. For SBIRs and STTRs, they want to see this product development and de-risking sort of pathway. So it's more vertical. They want to see this pathway going from how the product is being developed, how it's being de-risked, and how it's going towards commercialization. And finally, for the environment criterion, in academic grants, it's very focused on academic labs, and that's basically it. Whereas for SBIRs and STTRs, it's much more common to see a mixture of clinical research organizations, academic partners, and business labs. So finally, how can you partner with an academic collaborator? Because usually for a lot of startup companies, they're 1-2 people, they're mostly virtual, you don't have a lab space, and there's a lot of research and development work that needs to be done, that needs to be outsourced. And that, that sometimes can happen, with a CRO, but a lot of the work sometimes needs to be done by an academic collaborator. So what are the advantages of partnering up with academics? So that usually strengthens the team by excluding experts. And that gives you the opportunity to iterate on your original plan. And it gives you access to lower cost labor, right? Because academic collaborators may be using postdocs or grad students, and those are usually cheaper than if you're using, contracts with CROs. However, there are also disadvantages of partnering up with academics. They may be slower than CROs, right? CROs, you have a contract, you say, I need this deliverable in 4 months, and that usually happens. Academic collaborators, they work at their own pace. There's also the issue with long lead times with pre-award officers. So setting up the whole sub-awards, might take longer than you expect. And also you need to negotiate, a sponsor research agreement. So anything that's related to how you're gonna license your product and IP issues, that is something to consider. So what is the difference between SBIRs and STTRs? So for SBIRs, the company retains 66% or more of the budget, and the PI of the project needs to be at least 50% employed by the company, by the small business. Whereas for STTRs, the academic requires to have at least 30% of the budget. The company needs to have at least 40% of the budget, and the remaining 30% can be had by either of those two or by a third party. But for STTRs, the PI can be employed by the company or by the university, which can sometimes be an advantage when no one from the small business, has a qualification or the time to be serving as the PI of the project. Okay, so a little bit of further information. All the Kentucky Innovation Investment Program participants are eligible for a free copy of our Phase 1 book. So weeks 4, 5, and 6 in the book cover the research plan, which is what I just talked about today, in more detail. So if you are a KIP participant and you don't have a copy of the book, please email your address to molly@evagarland.com. I will send you a copy. So KIP is here to help you. So if you are in the KIP program, your scientific consultant, we can help you lead a strategy session to discuss your specific aims. We can assist you with developing the key points to include in your significance, innovation, and approach sections. And we can review drafts of your research plan. So please do not hesitate to reach out to Christine so she can set you up with us. The next steps, in addition to a strong research plan, you will need to provide a compelling commercialization strategy, which will be the topic of our next webinar on April 16. So I hope you will be able to join us then. And for now, this is all. I hope this was helpful.